This is Benjamin Smith, one of the scientists at the RI in the core. It gives me great pleasure to introduce this seminar because I have received many questions about how to get research started at the SIM, how to conduct research at the SIM. I am a user of the SIM, so I'm really excited to hear exactly how to do this from the experts. Our two speakers today are Jacinthe Baril and Jasmine Poole. Jacinthe I've actually known for quite a while, since back at the old Montreal Chess Institute. She was conducting research there while I was a trainee. She holds a Bachelor of Science degree from Concordia University and also a Master of Science degree from McGill. She has a graduate certificate in business administration from the John Molson School of Business. She also has many accreditations, FKQ, CCRP, SOCRA. Perhaps you can tell us what those stand for. But I think most importantly, she's been conducting research in the same environment that we conduct research for the past many years. And she's also really been at the SIM since the start, getting the platforms up and running. So I think she has a lot of expertise that she can share. Jasmine Poole has also been doing research in our environment, working with Dr. Louise Pilote since 2004, and she has a research technician degree from College Rosemont. So I don't want to take too much of their time, but I think the title of this seminar is very apt, breaking down barriers, how to get your project started at the SIM. So I think for many of us core researchers, this is exactly what we want to know. So perhaps I'll let the speakers sort of introduce their forum. It's, as I understand it, it's a sort of question and answer between the two of them, which I think will be very high yield. So I'll hand it over to, I guess, Jacinthe and Jasmine. If you have any questions, you can either enter them into the chat, and we'll try to field most of them towards the end of the talk. If there's any urgent questions, then obviously we'll try to identify them and mention them as we go. Okay, take it away, folks.
Perfect. Thank you very much for the introduction. It's a pleasure to be here today. Thank you for the invitation. I've just shared my screen. Can you all see? Can you see, Jasmine, the presentation?
Looks good.
Yes, I can. Perfect.
So let's get started. Well, for those who've seen the movie, The 12 Task of Asterisk, one of his tasks is to get the A38 pass in the house that drives you mad. So that famous scene, for those who've seen it, shows how difficult it is when dealing with regulation, tons of paperwork that can discourage even the most hardened. So the goal of the presentation today is to inform you of the current process so that you won't feel like Asterix in that movie. And I hope that the information that I'll be providing will facilitate getting your project started at the SIM.
Yeah, Jacinthe, it's exactly it. I agree so much. I've been around so many years, and not to say that I'm old, but I've been around many years. And I was here when the whole SIM thing started. I know it's overwhelming when you start a project, and it can be crazy at times to, who do I contact? Where do I go? What do I do? So for those of us who are maybe not even on site or who are new at the Research Institute, maybe you could tell us, where exactly is this Center of Innovative Medicine, which is called the SIM?
So where is the SIM? The SIM is located at the Glen site. With the big red arrow, you can see where the SIM is. It's on the 4th floor, block B and C. So we're just above the main entrance of the RVH and the Montreal Children's Hospital. Something that you should also know is that we have other facilities in the Glen, such as the operating room on the 3rd floor. We also have sleep lab in the block D. We also have facilities at the MGH. But the main location is here at the Glen.
Okay, and Okay, so now we know where the sim is. Who can use the sim? Like, is it only open to Research Institute investigators, or can anyone from out doing research use the sim?
So the sim is for all RIMUHC affiliated researcher for REB approved projects. So only research study participants can be seen here at the sim. So any clinical patients has to be seen in clinic. It's only when they are considered research participants that they can be seen here at the sim. So all principal investigators and co-investigators, they must have their research privileges. And to get that, they'll have to go on the RI portal and complete a little training and pass the quiz. And similarly, for all their research staff, they have to pass the clinical research certification, which is a combination of the good clinical practice course, as well as having read all the RIMUHC clinical research SOPs and pass the quiz. So by completing both, then these individuals get certified. Also, something I want to mention is that all the researcher, their study personnel, their graduate students are welcome to use the facilities to conduct study participant visits. Desk space, however, is reserved only for SIM affiliated RIMUHC researchers. And even then, we don't have a sufficient desk space to accommodate all researchers and administrative staff. So there are other considerations into the equation when that comes to desk allocation. So if the researcher is affiliated with the core or the CTB, then it's really, really unlikely that the staff would get a assigned desk space here, but they can use the exam room, and all the exam room have computers, so they can come here to see their patients, but not necessarily a desk for them to complete their work after. And in case you need the sim for purposes other than a clinical trial, let's say you want to give a tour to visitors with the foundation, or you need to do a photo shoot or a video or anything like that, it might be possible to do so, but we may have to have some kind of another agreement for that.
Okay, so now we know who can use it, but how can we use this famous sim?
To try to keep things simple, you can use it two ways. Either à la carte, meaning that the researcher has their own project, but they might just need a couple more services here and there, and we provide those services specifically. And the other option, it's projet clé en main, meaning that we take care of everything. From budget, regulatory, submission to ethics, we conduct the study, we do it from A to Z. So these are the two main ways at the moment that the sim can be used.
Okay, so now that I know like how I can use it, there's two ways. If I don't want to be like Asterix and go crazy, who do I contact? Like first thing, who do I contact?
Please make use of that email address, clinical.research@muhc.mcgill.ca. I think that's the best entry point. We are all human beings. We all tend to send an email to the people we know. But if we funnel everything through that initial address, it will be redirected to the appropriate individuals who can help facilitate depending on what you'll request or what you need.
Okay, so clinical.research@muhc.mcgill.ca. Everyone write that down. So it's a one email first thing to do, but how do I know what to ask you for what I need? Can you help us out here, Jacinthe?
So well, what are the resources available to the PIs? Of course, you won't know what to ask if you don't know what we have available. So let me tell you a little bit about our resources and our facilities. So this slide shows a brief overview of the technical expertise that we have here, all the people that we have. So we have study coordinators, study nurses, project manager, ethics coordinator, budget specialist for industry sponsored trial. We have regulatory specialists, we have technicians, technologists, various healthcare professionals that has the expertise on the equipment or technical expertise. We have data management specialists who can provide training with REDCap or designing your electronic data capture. We have study monitors, and there's also biostatistics, but it's actually Raman and now is affiliated with the core, which it makes sense. Now let me mention all the facilities that we have. So you might have an interest in our containment level 2 lab. We have a team of medical technologists who's there to collect samples such as blood draw, urine, swabs, etc., both on adult and pediatric participants. We also offer specimen processing services and storage services. We can take care of ordering your dry ice and preparing shipment. If your study team prefers to manage the sample collection and the processing by themselves, it's possible to do so. Our lab can be used unassisted, and the equipment is shared by all users. You can reserve the biological safety cabinet or counter space. We offer a mandatory safety lab training prior for you to get access to the lab, but once you're all set, you can make use of this lab.
So Jacinthe.
Yes.
Oh, okay. You continue. We're not there yet. Sorry. So much to say.
Yes, I just want to mention all the different things that we have here, so it can bring some questions probably. So fill in the chat, and we'll leave plenty of time at the end for questions. I do want to mention that we have imaging services, a CT scan, an X-ray, a DEXA. Thank you to Dr. Morin. We have now an PQCT at the SIM. We have a dedicated time slot on both adult and pediatric MRIs. We have other equipment such as echo or ultrasound here. We have functional testing areas. We have pulmonary function testing, cardiopulmonary exercise testing, exercise training facility, electrocardiogram, sleep lab, walk test, and so much more. It's been not too long ago that we have been adding some pages on the RI website, so you might go on the website, and we have a link with a list of the equipment that we have. It's an incomplete list, so before you write a grant or or have a need for a new piece of equipment, it might be worth checking with us if we might already have the equipment that you need for your study here at the SIM. You might also have an interest eventually for 3D printing services, bronchoscopy. We have an operating room. We have facilities that can accommodate various medical procedures and invasive procedures. And again, we have a nice simulation lab. So you can also check that website. I've put the link there. I was going to say the PowerPoint will be available for you, but it's all recorded, so you'll have access to all this information.
Yeah. Okay. Whoa. That's it is a lot of facilities. We're really lucky. I mean, we have a lot of resources, a lot of people, a lot of technicians also who can help us use all this resource. But there's also some unassisted facilities that we could use because we don't always need a technician. I mean, we could take blood pressure on our own, things like that, right? Can you tell us a bit what unassisted facilities we can use at the sim?
Yes, absolutely. So there are many things that are available to you. So first of all, we have two receptionists to welcome your pediatric or your adult study participants. We have waiting areas for your participants. They get screened at the entrance. We have multiple exam rooms that can be booked for free. Same thing with the large patient rooms. We have hallways that are 30-meter long, so they can accommodate all kinds of walk tests, such as the 6-minute walk test. We have skills, stadiometers. Depending on your study need, we have larger areas with multiple beds, such as the prep and recovery area. Something I want to mention that it's always possible for a child to be seen in Block B or vice versa, an adult in Block C. It really depends on your study and the needs. So, so I'm just putting this information out there. And yes, there's a few like the ice machine and the microwave and all of that. If you get to come here, we can show you all the different facilities that we have.
So we can ask for a visit and come over and see what you have, right?
Yes, I strongly recommend that approach.
I strongly recommend it too, because Jacinthe is really nice. It is impressive to visit the sim. If you haven't and you don't know what's going on there and you don't know what's available, it really is impressive to have a visit and see everything that's available. But
yes, we have a lot to offer, and I'm really proud to facilitate all the studies.
Okay, but like we're doing Zoom right now, so we can't. Can we go over? I mean, can we even start a study now? I mean, we're in COVID time, right? So can you just help us out a bit? Because research is still happening. We're not stopping everything, but how can we do it these days with COVID?
Yes, absolutely. Just before I talk about COVID, I just briefly want to mention that not everything is free, obviously. So if you need specialized services or to reserve some piece of equipment, then there will be a fee. So the fee schedule, it's available on the RI portal under the section, under the SIM Center section. So yeah, I just wanted to briefly mention that.
Thank you. I completely forgot that. Yes, I mean, life is not free, right? So, but with that first email, and then we get organized, you'll help us out with costs, right? You can send us a schedule for fees, or if we need, right?
Right, we can prepare quotes if you're not sure if it's better for you to handle your own specimen processing, for example, or delegate that to our team. We'd be happy to review your manual and provide you with a quote, and then you decide at that point.
That's great, thank you. So back to my question that I said just a bit early. Because of COVID-19, can we do studies at the sim?
Yes, we can. Research is as opposed to McGill, I just saw that all human research at McGill has been stopped. Here we continue. You must use the mandatory COVID-19 screening questionnaire. So nobody at the sim must screen positive, whether it's an employee or a patient. We do not do any COVID positive studies at the sim. So everybody must screen negative. So you must pre-screen your participants on the phone, and they will get screened again with the appropriate questionnaire, depending if it's a pediatric or an adult participant, by our receptionist. And you will need to ensure that you have your own PPEs, depending on what you'll be doing as a procedure here. So if you need to obtain any PPEs that wasn't necessary before, if it wasn't for COVID, you need to send an email to RI Purchasing and CC Gerald. And it's everyone's responsibility really to read and to apply the latest MUHC policies. In the past few months, they've updated many policies, and the screening questionnaire has changed versions. So it's very important to keep abreast of all the new information available on the MUHC portal.
Okay, I have a question because this happened to me. I've done studies at the SIM. So there's space available. I can rent or borrow one of the exam rooms. But what if I have equipment that it's too heavy, it's too big, I can't bring it every time I come, you know, for an assessment? Mm-hmm. Is there any way we could store equipment there? Because I know as a rule, you can't leave anything in the exam rooms, which makes sense, or we'd be overcrowded. But is there any arrangements we can make with you?
It's really on a case-by-case basis. Like you mentioned, the exam room, well, you can book any exam room available. They have slightly different setups, but most of them are similar. So if you leave a piece of equipment in a specific room, then it would mean for you to always use the same room, and it might not be available because it's a first come, first serve system that we have at the moment. Therefore, the first thing that you need to do is really to inform Biomed of the piece of equipment that you plan to bring in the SIM, because they will need they will properly certify your equipment just to ensure that we have all the documentation in place, that it's safe for the patient. Mm-hmm. And if it's a large piece of equipment, again, make use of clinical.research@muhe.mcgill.ca, and we'll discuss how we can best accommodate leaving this piece of equipment at the SIM. Storage is a true issue. We have very limited storage space, but again, if your study, it's a need, we'll have to find a solution.
Thank you. I know you did find a solution for me, and I was very happy, because sometimes you can't just bring everything over, and you are flexible. And I think it comes down to communication, right? Talk about it, organize, and I know you helped me, and we found a way through it. So thank you guys at the SIM again. Okay, so this is a lot of information. Maybe we should recap. So could you remind us the next step? I want to do a study. Please remind me the next step.
First, you need to think about your needs. And my advice is really prepare an email or multiple emails and send it directly to clinical.research@muhe.mcgill.ca. I also strongly recommend that perhaps you request a visit of the SIM, because that would really allow us to take the time with you, and you'll get a chance to explain your project and explain your needs, and we can show you the different options and the facilities. That's definitely my advice. Also, either by email or during that meeting, we'll be really able to give you all the information that you need. If you need an ID card because you don't even have an ID card, well, that has to go through HR. And then if you need SIM access added on your ID card, how do you go about that? We can put you in touch with the right person, but I can already tell you up front that you'll have to send your certification that you've completed, clinical research certifications. Same thing, if you think that you'll need the specimen processing lab, we'll make sure to put you in touch with the trainer so that you will be able to complete all the mandatory trainings, the good clinical lab and the transport of dangerous goods, and basic safety training so that you can have access to the lab and work safely in this environment. And if you do require the lab, then you'll also need to be trained on how to use iLab, because you'll want to make a reservation of the biological safety cabinet. Again, you might have a need to send samples to the central lab of the RVH for analysis. So you might be interested in Cerner training. This is to print the labels to put on your vacutainer prior to shipping them through the pneumatic tube system. If you don't yet have access to MUHC Internet or the RI portal, we can tell you how to go about accessing all those tools, because they're really important. If you plan to reserve the exam rooms or the patient room or the large facilities that are all free of charge, you'll have to reserve them through MediVisit or e-rendezvous. The hospital use these systems for clinic, and we use it for room management system. So keep in mind that usually you have to have the medical records number of the study participants when you need to make some bookings using MediVisit or e-rendezvous. There are workarounds when that's not always possible. You might have a study participant that does not yet have an ID card. So we can give you the specific instructions for that if that's your case. If you need medical records access, you have to submit a C2 system, an email to c2system@muhc.mcgill.ca to request OASIS access. And again, that's the initial process, but then you'll be requested to send additional information, such as a confidentiality form, a confirmation letter from your PI that you truly need access, a copy of the REB. So there's always extra steps to every system that you need. If you plan to work remotely, Citrix and IRIAS is what you'll need. So again, definitely request a visit, ask your question, and we'll direct you the best way we can.
That's great. So yeah, this is like a lot of information. I know you're going to tell us something really exciting that will be coming up eventually, where I can find all this information in one place. Is it possible?
We're working on it, so I can't wait to have this this onboarding package. In fact, it's the SIM is currently working on an onboarding package, and the format will most likely be like the new HR orientation. It was an email earlier this week. I don't know if any of you had the chance to go take to click the link and do the little HR orientation. And the purpose is really towards new SIM employees, but the content of that link will be applicable to anybody who need to make use of the SIM. So, and as we're just building this now, please tell us what you'd like to see in this guide. A request that I often receive is, can we have a map for our patients to go there? Can you tell us about all the different software and what they do and why would I need them? Anything else you can think of, please let us know what you'd like in terms of content in this guide.
And we can mail that to, where can we mail that to?
clinical.research@muhc.mcgill.ca. So yes, if you have any questions, suggestions, yes, you can still email me. I'm always very happy to assist anyone. But I think it's great that everything can be captured through that initial email to begin with.
Yeah, I think it's very important that we all have one place to ask all our questions, and this way we won't get lost and we won't feel like Asterix, right?
Hopefully not. We cannot necessarily simplify the process, but we can guide you through the process.
Thank you, Jacinthe. This was really, really, really informative. I wished you were around many years ago when I started, but when we hooked up and I was able to, you helped me out a lot to get my research going at the SIM, and it's really important to have good contacts. And then, I mean, time helped us go through all the different steps, but now we can get there, right? One email. We're one email away.
Work in progress.
Work in progress.
So that's the end of my presentation. We have plenty of time for questions. I welcome all the questions.
That's great. Thanks a lot to both of you. That was a very pragmatic, I think, and real world introduction. So maybe before we open up the discussion, either through chat or on the microphone, I just, as a user of the SIM, and also having been around for a few years, I would just also mention maybe to consider the alternative. So conducting research procedures in the MUHC is actually not permitted outside of the SIM. And even this policy is being integrated into the REB process where, procedures that are proposed as part of research, they will scrutinize where it's being done and why it's not being done in the SIM. And the other side to consider is going elsewhere. Well, at least certainly in our field, which is respiratory diseases, asking patients who have agreed to participate in research to then travel to another site can be a real barrier to participation. And so having the SIM physically in the same location as where the patients are receiving their clinical care can go a very long way to enrollment and retention. So I'll stop there. Maybe I'll start by reading a comment. It's not really a question, but as Jacinthe mentioned and Kaberi is mentioning again, the biostats consulting unit is sort of being integrated into the core, and there's also work in progress to set up a very strong data capture and management platform. And so again, this I think will only strengthen the research offerings out of the RI, in that the SIM can become even more specialized and dedicated to the process of patient encounters, measurements, platforms, and so on. And the biostats and the data management can be handled by core, so you get maximum expertise on all fronts. Yes, I invite anyone else to ask a question if they have. Many thanks and accolades are coming in on the chat. Debbie has asked about whether, if we use the a la carte services at the SIM, do we need to have a contract in place between the SIM and the investigator? That's from Debbie DeCosta, I assume.
As far as SIM technical platform goes, the answer is no, because we are using iLab, and every time you make a request, you need to financially approve the request before we provide the service. So if you want to book a patient for a CT scan or a pulmonary function testing, you send the request, we tell you how much it's going to cost you, you approve, and then we see your patient. So that's why we don't need to have a contract in place for SIM platform services or equipment reservation. However, if you plan to make use of, you might have a need for a study coordinator or a study nurse, then in that case, we'll probably have to have some kind of agreement in place for that.
I have a question from a colleague. They were sort of initiating a project with intent to use the SIM, and at the REB level, they were asking for a sort of resource impact assessment, which is a question we often get if we're doing a study that somehow impacts the MUHC. But I had not heard of that question coming up when trying to use the SIM. Do you know who the contact might be, or how we get that information? Like, I guess you would want to know, well, how many participants or what platforms are going to be used over what time scale, so you can plan accordingly. But is there should I just email clinical.research@muhc.mobile.ca?
Well,
that's a starting point.
Obviously, if it's going to be a very heavy use study, we'd like to have a discussion even when you're at the point of writing up your grant. That's very informative. If you do plan to use the SIM and you submit through Nagano, there's a trigger that we get the information. However, there's no form for us to say, oh, we approve that the resources will be available for you.
It's just a notification. Okay, that's helpful. Maybe they misunderstood. That's helpful. Thanks. Okay, so I'm not seeing too much else on the chat stream. So I guess if there aren't other questions, then I'd like to thank once again Jasmine and Jacinthe. That was quite helpful. And hopefully that addresses some of the inquiries that we get. As Jacinthe pointed out, it's often you ask the person who sort of, and so I get questions occasionally, but I think this will clarify the approach for many. Thanks so much. Have a great day.
There is one question. Hold on.
Sorry.
To receive processing lab training, is there a cost?
No, it's free of charge.
That answers that question.
Great. More thanks from other audience members. Thanks again from me as well.
Thank you very much for the invitation again.
Take care.
Bye. Thank you so much, everyone.